Okay. Hello, welcome. We have tonight Dr. Kelly Barnes, who's here with us in a really special, I guess we call this a fireside, to share a little bit of a personal experience and a personal insight to the cannabis world. We spend a lot of time, teaching people about medical topics and how to cook and how to grow, but we don't really have a lot of personal insight. So I'm really privileged to have you here. I would love to start off and just tell us a little bit about you and sort of what initially brought you to consider cannabis.
Yes. Well, first and foremost, thank you for having me. I feel quite honored, so I appreciate that. So just a little bit about my background. I have been a practicing endodontist for 17 years. I've enjoyed the practice. It's been, both exhausting and exhilarating at the same time, treating patients in both and interesting enough, watching some patients during this opioid crisis and knowing that how addictive those medications are and really trying to balance addressing, their needs and expectations with making sure that it was being done in a healthy way. So, at the height of all of this, when Massachusetts was really cracking down on the tracking systems and the way, the opioid prescriptions or the amounts that were being given to patients were really being kind of tracked, basically, for lack of a better word. It really started me thinking, what alternatives could there be to address their pain needs with still, again, kind of making sure that I wasn't creating an environment that, making something worse. And then just from my own personal experience, after losing my mom and going through a really traumatic time during all of that, I, started having trouble sleeping and just overall stress and anxiety. And so started doing my own research. Cannabis was legal in Massachusetts at the time. I was brought to your clinic at the time. We had a conversation and I was basically telling you, why I was there, what my chief complaint was, how I felt cannabis, hopefully would aid, getting me back to where I had been and dealing with this trauma. And you really were so patient and you listened and you counseled me, basically. I mean, I really did not know much about cannabis at all at that time. I really didn't even know the strains or, maybe the modes of administration, I knew about smoking joints and all of that, but it was never a part of my life at that time. So you again guided me towards certain dispensaries that you felt, may be matching what I was hoping to achieve, with organic growing practices and testing and all of that. So I started at one dispensary and I felt the questions I was asking some of the people that I interacted with at the dispensaries, I felt like I wasn't getting as much information as I really wanted. So I started again to just do my own research, just slowly. And again, I continued the interaction with you. Your clinic and the your website and all of the resources that you have are just amazing, and you can really learn so much if someone's takes the time to take advantage of that. And I continued on and decided that when the whole COVID pandemic situation was upon us last year, I really started critically thinking about the practice of dentistry and not knowing how this virus, was impacting all of us. I have a father who's of the age that's in the very vulnerable population. So I really started to be concerned that if I continued to practice, I could unknowingly bring it to him, and I didn't, want to not be able to see him. So I took a pause from dentistry. And I found it interesting that a lot of people weren't talking about how risky it was to practice at that time.
Right.
Because the second I took a burr to someone's tooth, I create aerosols, and there's no social distancing. There's no, you
You're
can
right
have
in
all,
there, yeah.
all the PPE in the world, and healthcare workers were still contracting the virus. So it was a really introspective time for me. And I decided, again, I was just going to not practice at that time. I've enrolled in a cannabis education program through the College of Pharmacy at the University of Rhode Island. It's a 4-course accelerated certificate program on a graduate level. And each course basically explores a different aspect of cannabis. The first course was just kind of an overview, the foundations of cannabis, the history, some of the racism, the politics, all of that. The course I'm in right now is called Cannabis Therapeutics, and it's basically just certain medical conditions that cannabis can be applied to, and it's very scientific on a molecular level, mechanisms of actions and all of that, which I'm thoroughly enjoying, because I'm definitely a person that learns in a formal manner. I don't really like to learn on the job. I just never have. So to learn how and why this medicine impacts people and how it helps people is just fascinating to me. And again, it's not a cure-all, it's not a panacea. I feel that some of my medical and dental colleagues, they're a little hesitant, and there's still some stigma there. I think more stigma than they want to actually verbalize. And I think it comes down to education, and that they don't know enough about it. They don't know how it works. They don't know what conditions it could help address in certain patients. It doesn't ever seem to be the first line of medicine that's recommended. It always seems to be on the back burner. And I do think it would be irresponsible of my colleagues not to be educated on this, because again, so many people can be helped by this if it's applied in the proper way. And again, as I said, it's certainly, there's no cure-all. There's so many factors that come into play when a patient's being counseled or guided towards a specific mode of administration, a specific strain, a specific dose. And sometimes in the beginning, it's, our DNA is all different. So it's, people have to very, very conservatively find out what works for them.
Do you think the course, I mean, you're very likely one of the most educated people in your course, in your group. Do you feel like it's appropriate for people like you? Or do you feel like it's more geared toward people who have less experience, or is it kind of you take what you want from it?
It's pretty heavily science-based, and certainly there were prerequisites for the course. It's been, I think, academically, it's not as challenging for me as it is for some people in my course, only because I've had so much of the science before. So it's more of a review, but again, it's a review that I love. I mean, I love learning, okay, what neurotransmitters are targeted, and also the multiplicity of actions of, both of all of the cannabinoids and how they impact the system, and what the potential is to impact the system. And also, our research is certainly lacking because of the federal, red tape and illegality. I mean, as I have said to you before, I find it almost absurd that it's still a class 1 drug, where it's legal in 36 states and 4 territories. So that really needs to change, so that more research can be done, long-term research. And that's, I feel, that's seriously lacking in this country, because a lot of the valid studies that we're basing this evidence-based research, decisions off of are from other countries.
Mhm. Mhm. What was your sort of experience with cannabis before embarking on the medical sort of side of things? Did you have sort of high opinions of it? Were you at points curious? What was your perspective beforehand?
I was curious, but it was just never anything I sought out. For some reason, maybe it was my group of friends or whatnot. I wasn't around a lot of people that cannabis was a big part of their life. So I guess I hadn't had a lot of exposure to it until the medical angle of it.
Awesome. And how has the medical sort of experience been for you? I mean, you mentioned a little bit about the folks behind the counter, but overall, considering the things that you had mentioned, the things like difficulty sleeping and stress and anxiety, overarching sort of high level, how has the cannabis experience been?
So honestly, it's been fantastic. Once I figured out, what worked for me to address, again, the issues that I was dealing with at the time, my sleep disturbances and all of that. So again, in the beginning, it was a little bit of trial and error, but now once I've figured that out, no, it's been life-changing, really, to get me back to, finding joy in life again, and not having that anxiety and not walking around feeling like I haven't slept or anything like that. So no, it's been really fantastic for me personally.
Awesome.
And
Do you feel like your regimen has changed since you first started? I mean, it sounds like you were trialing things and bringing things on and taking things off.
right.
How has your regimen changed?
It has, as far as the smoking aspect of it. I mean, I just for me, that wasn't, I didn't feel like that was a healthy practice. So, I had initially, tried smoking and whatnot just to try it. But again, just from a health standpoint, that didn't really fit into my lifestyle. So, so I'm pretty much, I do edibles for sleep a couple times a week. And then a tincture if I feel, anxious or anything like that I just want to kind of just mellow out a little bit.
Mhm. And a lot of people who have no experience with cannabis imagine that it all tastes like a lawnmower. Do you have that experience? What are your impressions as far as the palatability of the cannabis?
Well, I again, not knowing what it had been like prior to the medical part of it, it was always like you never really knew what you were getting. So I find that the edibles are actually, really, dark chocolate. It tastes good. You don't actually really taste, the cannabis in it. So for me, again, I find it just like eating any other, piece of chocolate, but
Mhm.
knowing what it is and how it will make me feel.
Mhm. And just for the pleasure of your sort of experience, um, do you eat dinner and then the chocolate is a dessert and then you end up just conking out, or how does the sort of process work?
So I basically, I'm someone that I like to go to bed early and I get up early. So if I know what time, I kind of want to be asleep at, I'll usually eat a little piece at a couple hours before I want to be asleep. And it's
Mhm.
not, I wouldn't say it impacts me like all of a sudden I'm out like a light. It's a very slow, gradual relaxation, and then it just lulls you into a sleep that I'm allowed to stay asleep, rather than you fall asleep for 2 hours and then you wake up and it's difficult to go back. So so that's been, again, life changing for me.
Wow, awesome. A lot of people, I can hear, are sort of asking when they hear you sort of describe the experience, are you sort of passed out and unconscious the way some people have experienced Ambien? Or, have you had occasion where you wake up in the night, because of a loud noise or something, and you can go back to sleep?
Yes, yes. It's not like I've never taken Ambien or anything like that. I mean, before the cannabis, if I couldn't sleep, I might take a Benadryl.
Mhm,
But I always felt almost like you have a hangover in the morning,
mhm,
foggy, and I never liked that feeling. But
mhm.
I don't feel like that with the medical cannabis that I've tried, which is, you wake up and you feel energized, and you feel like you've had a great night's sleep.
Hmm. Awesome. So to turn the coin a little bit, are there experiences you've had that have been unpleasant or uncomfortable?
Yes, in the beginning, so a- and I won't even, mistakes happen, and I had ordered online some indica lozenges, and now with everything, you just go and order online and you pick it up, and they had actually given me a sativa strain, which I don't usually gravitate towards sativa, and it made me feel really almost anxious. It was having the opposite effect,
Mhm.
and I didn't like that feeling at all. And so, then knowing that, this was not something I was used to, and I didn't really like the way it made me feel. So certainly, that, but it was essentially just the packaging was the same. So it wasn't until I looked at it, I was like, oh, this wasn't what I ordered. So
Oh, what a drag.
but that was just, again, that was an honest mistake, and
Sure.
it was rectified. But as
Sure.
far as like the personnel at the dispensaries, I do feel it would be a great addition if they had someone, that had formal medical training
Mhm.
in the strains and the modes of administration, and also to try to match that with the condition that the person is trying to remedy. and
Mhm.
and I definitely feel like that was lacking, that I wasn't really being able to speak to people that were really knowledgeable about it.
Yeah.
And again, I mean, you were the go-to person for me, and so, but I didn't find that I was really getting that at the dispensary, so I feel like that would be a huge benefit.
Yeah, no, for me too. It's a silly sort of reality, but hopefully that'll change for the better soon.
Hmm.
Um, if you don't mind, I'm sure people are curious for a little bit of a window into what was unpleasant about the sativa experience for you. I mean, you mentioned the anxiety, but was there? What were you scared? Were you paranoid? Were you how long did it last? What was that experience like for you?
So I wasn't paranoid, but I almost felt like almost like this out of body experience, if that's it was this airiness, but an airiness that it was almost like my breathing was off, or it just, I don't know. It was hard to explain because I'd
Mhm,
never really felt like that before.
mhm,
It didn't, I didn't take a lot of it, and it would, because it was an edible. It did take an hour and a half to
mhm,
kind of take effect. And because I had only started off with a small piece, it didn't, probably lasted a couple hours or so. But yeah, it was a feeling that I wasn't really used to, and so maybe that was just anxiety provoking, just because I really hadn't felt that way before, and
mhm.
hadn't, the person at the dispensary didn't really. Well, again, it was a mistake, so they didn't really warn me about it.
Yeah.
But
But, um, a lot of people who are watching this will have never sort of engaged with cannabis at all. Um, have you had the experience of being high, and what's your sort of description of what that means?
so being high in the sense of,
Everybody's talking about this thing called being high, and someone who hasn't
what is
experienced
it?
cannabis. Yeah, what is it for you?
So that's kind of an interesting question, because when I was in college, one of a friend of mine in the dorm, she really was a heavy pot smoker, and so I tried it, and I kept asking her, what am I supposed to feel like? I'm not feeling anything. And she's like, you'll know, you'll know. I'm like, I'm really not feeling anything. And then you feel it. And that's, I think that was the high that I felt. It was like I mean, just time and everything slowed down. It was like I was in kind of this slow motion, things that I may not have found humor in were really funny and silly. And so that aspect of it was actually, quite fun. But yeah, it was just almost like a slow motion feeling.
Cool. Was it, a lot of the misinformation campaigns of the 30s, described cannabis as this addictive thing. There were, the reefer madness showed women sort of, nervous and unable to control themselves, jonesing for another cannabis sort of hit. Have you experienced anything like that where you didn't have any control?
No, I haven't personally, no.
Right. Okay.
And,
Awesome.
and that was another thing that I, in this program, I didn't think cannabis was an addictive substance. And, it's much less so than alcohol or cocaine or some of the, the more addictive street drugs. But it certainly can be abused. And the percentage is 9% of the population are typically abusers. But you're going to get that with anything too. There's always going to be, people that, will abuse it. Sure.
If we had, Jane Smith or Joe Smith here who have never consumed cannabis at all, what kinds of advice, I guess, would you give them, or recommendations or suggestions?
So, a thorough medical history, allergies, what other medications they're taking, what would they hope to achieve by using cannabis? And if they had never taken it before, I definitely, even if they had taken it before, definitely be conservative. You can always take a little bit more. You can't necessarily take it back once you've consumed it. So the conservative piece of it is huge. And also just, making sure that it's state certified, so that it's been tested and for, molds, pesticides, heavy metals, all of that. And that it's done in a safe manner. I mean, it's like anything else. I mean, you shouldn't drive under the influence of it. And sometimes people, and I've only heard this from other people, that they feel like, well, I feel fine, when they don't really know that they're impaired.
Right.
So that's very key too. So someone that's never tried it, always do it in a controlled environment. They shouldn't, again, be driving or anything like that. And just be very conservative with it.
Awesome. Are there other things besides the cannabis sort of in the environment around when you're consuming that you think have helped your experience be better? Like some people have nice music, some people have warm temperatures, or, funny show on or something.
Yes, I kind of feel like, anything that, even if you weren't consuming cannabis, I mean, I love music. I love live music, or when we could see live music. So anything that makes you, or that that is a pleasure, I think, is not a bad thing to incorporate with that.
Awesome. What are your impressions from one dispensary to another? Are these, I mean, these days we have over 140 dispensaries in Massachusetts. People have no idea if it's all the same or if it's all totally different. What's your impression?
And I've been to 3 in Massachusetts, and I find that it could be intimidating initially, especially if you haven't visited before, or you don't really know how this all works, and especially if you're not really sure of what products you're getting, or that you want to be able to purchase to, again, address the whatever condition that you're there for. So that, and they do differ quite a bit. So much is online now. And so, going to just kind of familiarizing, my recommendation would be check out their website, see what kind of products they have, see how the website is presented, see if they have some additional support. If they have someone there that you could speak to, either email or on a call or something, prior to going in. Because they definitely do differ quite a bit. And I have to say, I mean, I haven't had a bad experience at the dispensary. They just tend to be different. Some are very, very busy. And then others, are a little less busy, but maybe, more, less kind of customer service oriented, shall I say?
More Apple Store fancy kind of stuff, or as opposed to like a warm and fuzzy mom and pop shop?
Exactly. More like production of just wanting to push products
Right.
rather than, right.
Yeah.
How can I help you? What are you here for? Have you ever, been to our store before? Things like that.
Have you had a chance to try delivery here in Massachusetts?
I have not, no. But I know that it's available. I just haven't done it.
So I'm really interested to dive into the learning process that you've done sort of kind of formally about cannabis. What are some of the things that stand out as really surprising from either from your own knowledge in the past or from your own personal experience?
So what I found very, very interesting, and I had no idea that, and Dr. Stacey Gruber at Harvard Medical School is doing fantastic research on the adolescent brain and cannabis use, and how it affects the matter in the prefrontal cortex, and that's behavior, emotions, learning, memory, and that there's some disconnect in someone that uses cannabis as a teenager, uses it all the way through their adolescence when their brain is still quite immature. That's not a healthy situation for, and they don't, and again, she's still doing these studies. She's like, I don't really know the long-term effects of it on the brain, but it definitely, with her, the scans that she's done and the research that she's put out there, and certainly Harvard has, bigger endowments than other universities to do that research. But I had no idea how unhealthy it is, and that can the brain repair itself after it's been, somewhat damaged from cannabis use as an adolescent? That's what she's studying. And her recommendation was that 21 is kind of the cutoff. But then I've read other research that from other universities that say 24, 25. So there's always a range, and again, it's just that we don't know long term.
Yeah. For people that happen to be watching, Stacey is a friend actually, and we have all of her papers available for people to read if they'd like, through the Seed Archive. If people are interested, it's cedclinic.com/lib. And you just look up Stacey Gruber and you'll see her folder of all of the papers she shared.
Yeah, I found her research really fascinating.
Yeah, she's also a really kind woman and an incredible pioneer.
Definitely. But yeah, that was a huge, I had no idea that it could have that kind of impact on the brain.
Yeah. No, and I think the impacts neurologically also, can happen with people that are using even as adults. I think it's also, it's a matter of dosage and frequency and sort of other stimulation. Sometimes people get sucked into a crutch, no matter what that crutch is, whether it's eating or exercising or cannabis, and it can pull people into a spiral.
Yeah.
I'm curious for your impressions of cannabis from your sort of professional hat. You mentioned that the sort of stigmas out there, and that's kind of holding people back from learning. What do you think about the opportunities, I guess, within either dentistry or oral health, or even just kind of healthcare in general?
So, as far as dentistry goes, I think the aspect of the anti-inflammatory and the antibacterial properties of cannabis could definitely there's a place in dentistry for that, as far as, especially for periodontal disease and decay. And again, with the Farm Act being passed in 2018 and the flood of all these CBD products coming on the market, and that not being regulated the same way that, any other drug would be, people don't realize that all CBD is not the same. And these companies are not necessarily being regulated. So, the claims that they're putting out there, they'll say clinically tested. Well, where clinically tested is kind of a marketing term that,
right, wink, wink, yeah,
is thrown around. So, as far as that goes, I could definitely see, some oral rinses, to cut down on oral bacteria in the oral environment. As far as, pain management, there's a lot of dentistry that's just acute pain, but then the post-op pain, I could see an application there as well. Although I'm still kind of, trying to figure that out, what would be the best, the best delivery method, and what would be most impactful.
Speaking of pain, I know that you'd mentioned most of your use has been for sleep and some of the stress stuff. Are there experiences that you've had where cannabis was helpful for your discomfort? Pain, sort of physical pain?
Yes. So again, early on, in some of my research, I would go to some of the conventions. There was one in Providence. I went to one in Boston, and I bought some of the CBD, just topical cream, because if I would have a very difficult week at work and I would have very difficult cases, there were a couple joints in my hands that would start to ache, and so I would use the topical CBD cream at night.
Real joints, not the cannabis kind, right?
Right. No, these kind of joints. And it would definitely help. And it was almost, so my hand would ache, I would, massage it into just topically. And I could feel the effect of it maybe 10, 15 minutes after. So it definitely helped. The only issue with that is that you have to keep reapplying it, but
Right.
That was fine. I would rather do that than, take something. So
Yeah, sure. Are there people for whom you would recommend cannabis, and then are there people for whom you would not recommend cannabis?
yes. So, and it kind of goes back to the medical history piece of it too. So anybody with any kind of previous psychiatric disorder, cannabis may not be the best for them, because sometimes it can exacerbate psychiatric issues, or even if there's a predisposing other predisposing factors towards, psychological issues, then that would be of concern too. Patients that I would recommend it for, it really kind of depends on the condition that they're seeking it out for, and also, are they on any other medications for other issues, or basically what their lifestyle is, and it, as I said, there's not a one size fits all. It's really a case by case basis, and that's why I feel like a really thorough history, is so important to being able to listen to the patient and then to help them and guide them to what the best medication is for them, and that may not always be cannabis.
Are there people that you wouldn't recommend learning about it? For some people, they will feel, oh, I don't know if it's right for me. My shtick is sort of let everybody try to learn and see if it's right for them. Speak with a professional.
Absolutely.
You have the same impression?
I don't. Education is. To me, there's no bad education. The more knowledge someone has, the more power they have to make a decision to try to, help in managing their own healthcare and their own well-being.
Mhm.
So no, there's nobody that I would dissuade from learning about cannabis.
Awesome. And sort of along the same lines, what has your experience been with, some of the other professionals that you've interacted with, maybe your own doctors, and sort of how they've dealt with your cannabis?
It depends. It varies quite a bit. And I'll say, and not to generalize, but I would say that some of my older colleagues don't seem as welcoming to the idea of it being a legitimate therapeutic.
Mhm.
They kind of, grew up with it being like, oh, weed and it's a drug, and you know, you must be lazy and this and that. And but again, they haven't been educated about it. But
Mhm.
it's you. I think someone like that really truly needs to be taken through all of the education of it, um, and to slowly try to change that perception. And
Mhm.
as I said earlier, again, as a medical professional, I think it's irresponsible for all of our colleagues not to be educated on this.
Yeah, no, I tend to go one step further, which is to say it's unethical.
Yeah,
That I think if
I would agree.
yeah,
100% agree. Yeah.
we're not in ancient times. Nobody's doing craniotomies, a hole in your skull to pull out spirits anymore. And I think,
Right.
I mean,
Right.
it's a silly example, but we're also not. We don't need to demonize cannabis anymore.
Absolutely. Yes. And it's
Um,
it's definitely changing. I mean,
yeah,
it's definitely changing, but change happens slowly. But
sure.
I feel like we're going in the right direction.
Agree. Did you have any experience with your own clinicians, or people that around like that were taking care of you, and sort of did that come up at all?
Yes. So my primary care, who I had been seeing, she's now since retired. She really had no real experience with it, no real knowledge of it, and didn't really want to have much of a conversation with me about it. And I think again that was just, she didn't know,
Mhm.
so she just kind of was quiet about it.
Yeah.
I was asking her some questions, and she was honest. She
Mhm.
was by saying, I don't have any experience with it, so I can't really comment.
Okay. Well,
And
that's
that she
helpful.
kind of left it at that.
Yeah.
So
No,
and I
I,
kind of
I've
okay.
I've watched that evolution with Glee. Actually, I remember distinctly. When I first began, nobody talked about it. I don't want to hear about it. Don't talk. Don't even mention it. We're not allowed to talk about it. And that evolved over time to, yeah, do with your body whatever you want. It's your choice. And then it was sort of more of a, I don't want to hear about it, but I am fine with whatever you're doing. And that has actually come full force, where I actually have people, doctors referring to me as a first line for some conditions, where they've seen their other patients succeed, by and large, and they're open to this being an option. And of course, I get all of the very very sick people, the folks who are complaining about their discomfort and just absolutely miserable, and they bring that misery, of course, to the doctors. Those patients are referred quite quickly, because
Mhm.
I love them. I think we are all suffering, and I love to see the results, the dramatic results of those people getting so much better.
And
Um,
that has to be so satisfying
oh,
too.
it's yeah. I
And
feel like the
when
luckiest clinician, sure.
when people have tried everything and they really have success, yeah, that has to be so gratifying.
Right. Although, I mean, as you said before, a lot of people see this as like the Hail Mary at the end of their road,
Right.
where they've tried this and that and the other thing. And I think once they have tried it, they're like, gosh, why did I start this first? I mean, it's such
Right.
a
Right.
difference from what people expect.
Yeah.
Um, you'd mentioned the sort of stereotype that we all kind of grew up with, which was that, makes people lazy or slow.
Hmm.
Um, what is your experience? I guess the day after you've consumed, or times where you are consuming and are still doing something that requires you to be sort of alert and with it. What's your experience of cannabis, either making you slow or not?
So, and again, I use it primarily for
Right,
sleep.
right.
So I kind of, I don't I'm not consuming it during the day or anything. So I kind of look forward to the evenings that I allow myself to do that, and know that I'm going to sleep really well. And as I said to you before, the way it makes me feel is just this lovely sense of relaxation. That
And sharp as you've ever been, or do you feel like it's dulled your
no,
senses over time?
I don't feel cognitively dull at all. I feel mentally very sharp, just physically relaxed.
Sounds wonderful. All
It
right.
really, and I
Um,
wake up, as I said, I don't
yeah,
feel
refreshed.
lethargic. I feel fantastic.
Wonderful. If you went a couple days without consuming, after you've enjoyed this refreshing sort of relaxation, do you feel an effect having not taken it?
So I don't take it every night. I limit myself just to try to discipline myself.
Mhm.
So I usually will take it 2 or 3 nights a week,
Mhm.
at most. But no, I mean, I like that kind of, I can look forward to it, and then there are nights that I don't really need it. So I kind of really titrate it myself.
For those nights where you're not taking it, and maybe you took it a couple nights before that, do you,
Mhm.
and you were just saying you sort of might not need it, do you feel like the cannabis is carrying you through even on the nights where you're not taking it?
Possibly, and that could even be, the placebo effect. I mean, I don't really know that answer for you. It's just subjective.
Right. No, of course. Granted, but I mean, I guess the question I'm trying to ask is that I didn't ask it very well. Um, do you feel like you have lousy sleep on the nights that you don't take cannabis, and only good nights when you're taking the cannabis?
Not necessarily. The nights that I take it, certainly I have the best sleep. And then other nights, it really kind of depends on what's going on in my life too, what my stress level is
Sure,
like.
sure.
It's that kind of like, being in school, like, oh, okay, what do I have to do this week? Am I going to get that paper done? Have I studied enough? That it's kind of letting go of all those thoughts. If I can let those thoughts go, then I sleep fine. If I can't, that's what keeps me up.
Awesome. So I want to give an extra special thank you, Dr. Barnes, for sharing so much about you and your experience. It's really been spectacular, and I can already tell you that I'm going to get so many people who will appreciate your words and insight and encouragement. Thank you for spending your valuable time with us. It's really been sensational. I'm so
Well,
grateful.
again, thank you for having me, and I certainly I would love to help anybody out if I can. But no, it's definitely something that people need to be educated on, and that our lawmakers, we need to start changing
No
these
kidding.
laws.
No kidding. Where do you see your sort of education taking you professionally or personally?
So I'm kind of figuring that out right now. Just looking forward. Again, I would like to still work with patients, and maybe in the capacity of counseling patients at a dispensary, or I haven't really settled on one thing just yet.
If some of the people who watch this happen to be in the industry and are potentially looking for either advisors or people to help with a business, would you be interested in those kinds of opportunities?
Yes, absolutely, I would.
All right, great. Well, this has been a real treat. I'm so thankful for you spending this time with us.
Well,
Um,
thank you again.
all right, yep. Thanks. Have a great night.
All right, thanks, Dr. Ben.
Bye bye.